Welcome. Today I am taking the critical care nursing test paper 3 part 1. In test paper there are 50 questions. The part 1 including 10 questions only. Who are preparing the OAT, SNB and HAT and Prometic? It is very important questions and it is very with explanation is there. Along with it helpful for NORCET and AIIMS and ESIC and RRB examinations and JIPMAR examination and UPPSC examination and TSPSC examination and Tamil Nadu PSC, and who are preparing for the CHO and MLHP examinations and Kerala PSC also. It is very useful for this question paper. So don't skip the video till end. You can watch, you can easily understand these questions and explanation. With explanation I am giving. Thank you. So we are entering to the topic 1 and part 1. The first question is, what is the action should be the nurse take when the carrying the client with the anaphylactic reaction? The correct answer is administer the oxygen and maintain the airway potency. The explanation is, if the client is experiences the anaphylactic reaction, the immediate action should be assess the respiratory status and quickly maintain the patient airway potency. The primary healthcare provider or rapid response team is called. In the meantime of the nurse stays with the client and monitor the client vital signs and along with the signs of the shock. An IV device is inserted in the one or not already in the place of the normal saline is infused. The nurse then prepare for the administration of the deriphenamine and epinephrine and other medications are also prescribed. The head of the bed is elevated if the client blood pressure is normal. The client's feet is legs may be raised if the blood pressure is low. The nurse document of the event of the action taken and the client responses. The second question is, the nurse has prescription of the insert peripheral intravenous catheter place and step of the perform this procedure in the correct order of priority. All option must be used. The correct answer is tape the secure of the site with the transparent dressing. Check the primary healthcare provider prescription first. Why? Because if you want to transfuse the blood transfusion or other saline transfusion or injection giving, what are all the needed for the intravenous catheter? So based upon that you should insert the intravenous catheter. The explanation is, the nurse check the PSP prescription if the intravenous a line and then determinant of the type of the size infusion devices. The type of the size important is secure adequate flow and prescribed solution. For the example, if the size blood delivery and the nurse also consider the client size, age, morbidity and other factors of selecting the size and transfusion devices. The nurse prepare the appropriate IV tubing and extension and set up the premises. The tubing or extension set up the remove air from the system. The appropriate vein is selected of the tourniquet and apply the vein checked, palpated or not. For resistance, stick the surgical asepsis employed and the skin is cleaned with the antimicrobial solution using the inner outer circular motion. The vein is stabilized to prevent the its movement and the skin produce punctured blood in the flashback chamber indicates that the device in the vein. And when the noted catheter carefully advanced and avoid punctures of the black wall of the vein. The tourniquet is removed, the stylus removed from the catheter device. The IV tubing or extension set of the concentrated with IV flow is started from following assessment and client and site of the nurse forceps. Secure the site and label tubing, dressing and solution bag appropriate and According to the agency policy, the nurse check the site of the exposure that the solution is flowing. Finally, the nurse document the specification about the procedure. The third question, a client had a radical neck dissection and beginning to the hemorrhage at the inclusion site of the nurse should be take which action in this situation? The correct answer is monitor the vital signs and monitor the client airway. The explanation, if the client beginning hemorrhage from the surgical site, radical neck dissection, the nurse elevate the head of the bed to maintain the airway potency and prevent the aspiration of the patient. The nurse applies the pressure over the bleeding site and cell of the PHCP immediately. The nurse also monitor the client airway and vital signs of the continuously. The fourth question, the nurse in a labor room is performing vaginal assessment of the pregnant. The client in the labor as pregnant client in the labor room, the nurse note the pressure of the umbilical cord and protruding from the vagina. What is the first nursing action with these findings? The correct answer is place the client Tenderberg position. The explanation of this question, when the cord prolapses occur, promote the action are taken to relieve the cord and compassion and increases fetal oxygenation. The client should be positioned with the hip and higher than the head shift the fetal presenting part of the towards of the diaphragm. The nurse should be push the cell light and someone help to other staff members should be call the primary health care provider and notify the delivery room. If the cord is protruding from the vagina, no attempt should be made to the replace it because of to do so cloud traumatize it to reduce the blood flow further. And also it has the first option, the examiner should be placed and a glove head into the vagina and hold the presenting part of the umbilical cord. Keep the oxygen 8 to 10 liters minute for the face mask administered to the client to the increase fetal oxygenation. The fifth question is, a pulmonary artery catheter inserted in the client during the cardiac surgery. The nurse is monitoring the right arterial pressure, which is the finding required immediately nursing intervention is. The correct answer is 12 mm of HD. The explanation is the normal RAP 1 to 8 mm of HD, therefore of the all option within the range of the are normal, and RAP is can be indicative right ventricle failure. The sixth question is, a client with admitted with the hospital with diagnosis of the diabetic ketoacidosis, the blood glucose level of 950 mgdl, a continuous intravenous IV infusion of short acting insulin is initiated along with the IV rehydration with the normal saline. The serum glucose level now increased to the 240 mgdl. Then the nurse would be the next prepare the administer the which medication. The correct answer is 12 mm of Hg. The explanation is the normal RAF is 1 to 8 mm of Hg, therefore all within the range of the normal. An elevated NB right ventricle failure. The seventh question is, a client admitted in the hospital with the diagnosis of the diabetic ketoacidosis, the initial blood glucose level 950 mgdl. The continuous intravenous IV infusion short acting insulin is initiated along with the IV rehydration with normal saline. The serum glucose level now decreased to 240 mgdl. The nurse would be next prepared to administer which medication. The correct answer is IV fluid containing dextrose. The explanation, emergency management DKA forces on correcting fluid and electrolyte imbalances and normalizes the serum glucose level. If the correction occur to the quickly serious continuous consequences including hypoglycemia and cerebral edema can be occurred. During the management of the decay, when the blood glucose level falls to the 250 to 300 mmol or until the client recovers the ketosis 50% of the dextrose can be used to treat the hypoglycemia. The NPS insulin not used to treat the decay. Phenytoin is not usual treatment for the measure of the decay. The eighth question is, the nurse who is about the beginning blood transfusion known as the blood cells start to the deteriorate after the certain period of the time. The nurse take the which is action order to the prevent complication of the blood transfusion as it is related to the deterioration of the blood cell. Selected all the apply. The correct answer is check the explanation of expiration date. The explanation, the nurse notes the expiration date to the unit of the blood export. The blood is fresh or not. Blood cell beginning to the deteriorate over the time, so safe storage usually is limited to the 35 days. Carefully notation of the expiration date by the nurse is an essential part of the verification process before the hanging of the unit of the blood. The nurse also need to hang the blood within the specified time and frame after receiving it from the blood bank as per agency policy. To the ensure that the blood beginning transfusion is fresh, the blood bank keep the blood regulated at the specific temperature and therefore the must be transfused within the specific time and frame once the received in the blood of the unit. The nurse also note the blood identification unit number and blood group and type and client name, but also not specifically related to the degeneration of the blood cells. The nurse also inspect the unit of the blood and leaks and abnormal color, clots and bubbles and returns of the unit to the blood bank. Return to the unit of the blood bank are noted. Again, this is not related to the degeneration of the blood cell over the time. The ninth question is, the police arrive the nurse emergency department with a client who has lacerated both wrist and which is the initial nursing action is. The correct answer is assess and treat the wound of the site. The explanation of this question, the initial nursing assessment, the nursing action is to assess the treat and self inflicted injuries, and injuries from the lacerated wrist can be to a life threatening situation. Other interventions such as option 1 through 2, 3, 4 may be follow after the client has been treated medically. The police arrive in the emergency department with client who had lacerated both wrist and which is the initial nursing action. The correct answer is assess the treat and wound of the site. Okay, thank you. Today we have discussed critical care nursing test paper 3 part 1. There are 10 questions. Total 50 questions are there. So wait for the part 2. Thank you very much. For more details, follow in my Instagram and Telegram channel also. Thank you very much. Subscribe to my YouTube channel.